Hello, welcome back. We are on chapter 6 and we are going to be discussing anatomy and physiology. This is again another very important chapter for you guys to know and understand. This is going to be that baseline of the rest of your EMT course. So if you don't know and understand anatomy and physiology, you are going to struggle through the rest of this course. So please take the time, read your books, listen to the lectures, understand what's going on. If you have questions, don't hesitate to reach out. Topics that we're going to discuss are locating body organs and structures and the body systems. In this section, we're going to be talking about locating body organs and structures. So there are two ways to help locate organs and structures of the body. It is important for you to learn both ways, as on almost every call, they will be dealing with the body of a patient and will need to identify the organs and structures that you'll need to care for. All right, we're going to start out with locating body organs and structures. So there's two ways to help locate organs and structures of the body. First is the visualizing or being able to picture it. And then the organs and the structures that are inside of the body as you look outside of the body. And then the second is the topography or the external landmarks, such as notches, joints, or bumps on the bones. Some external landmarks are very obvious, so like the navel or the belly button and the nipples. So you can see those. Some of you may know them by other names, but we'll talk about learn them in their medical terms, but we'll also talk about straight language as well. And then we'll talk about the Adam's apple, which is properly called the thyroid cartilage. So how many people know it as the Adam's apple? Probably most of us sitting in this room, but the actual medical terminology is called the thyroid cartilage. And in some, they will probably be new to you. So like the xiphoid process is the inferior part of the sternum or the breastbone, as described obviously later in this chapter, so you haven't actually learned that yet. It is important to learn what and where the internal organs and structures are in relation to the landmarks so that you can easily see or feel on the outside of the body. All right, let's talk about the body systems in this section. All right, let's start off with the musculoskeletal system. There's three main functions. One, it gives the body the shape. It protects the internal vital organs, and it provides for your body to move. The skeleton consists of the skull and the spine, ribs and the sternum, shoulders and upper extremities, and the pelvis and the lower extremities. You have the skull, which is the bony structure of the head. Its function is to enclose and protect that brain. You have the cranium, which is on the top, the back, and the sides, and then your face, which is the front of the skull. When you talk about the cranium, which connects to the facial bones, so the bones are of the anterior cranium, which connects to those facial bones, including the mandible, which is the lower jaw, and the maxillae, which is the fused bones on the upper part of the jaw. Then you have the nasal bones, which provide some of the structure of the nose, and then these bones then form the facial structure. But some of these structures consist of multiple bones, such as the orbits, which then surround the eye, and then the zygomatic arches, which then form the structures of the arches. So here is the skull, which consists of the cranium and the face. All right, so we got the spinal column, which is 33 vertebrae that are encased in the spinal cord. What is your spinal cord essential for? It is essential for the movement, the sensation, and the vital functions. Then you have your thorax, which is also your chest, which has the 12 ribs in the sternum, and it protects the heart, the lungs, and the major blood vessels. Here you will see the divisions of the spine. It goes in the cervical, which is the 1 to 7. Well, first you have your atlas, which is C1, then your axis, which is C2, then you got your cervical, so C1 through 7. Your thoracic is T1 through T12. Your lumbar, which is L1 through 5. Your sacrum, and then your coccyx. All right, let's talk about the pelvis. So the pelvis is sometimes referred to by lay people as the hip, although the hip is actually the joint where the femur joins the pelvis. So the pelvis actually contains the bones that are fused together. So the ilium is a superior bone that contains the iliac crest, which is that wide bony wing that can be felt near the waist. And then the ischium is the inferior posterior portion of the pelvis. And then we have the pubis, which is formed by the joining of the bones of the anterior pubis, and then the pelvis is then joined posteriorly to the sacral spine. So the hip joint consists of the acetabulum, which is that socket of the hip joint, and then the ball at the proximal end of the femur. All right, then on to the lower extremities. So the pelvis and the hip joint described previously is also considered or may be considered part of the lower extremities. So if they talk about lower extremities, that could be part of it. So moving down from the hip, then you have that large thigh bone, which is the femur. And the femur is that largest bone in the body. And it has a slight bend at that proximal end where it attaches to the pelvis. So this bend is a frequent site of fractures and is commonly broken when the patient breaks a hip. So then progressing down the leg, you have the patella, or what we know as the kneecap, and it sits anteriorly to that knee joint. Then the knee connects superiorly with the femur and inferiorly with the bones of the lower leg, which is the tibia and the fibula. So the tibia is the medial and the larger bone of the lower leg, and it's also known to us, though, as the shin bone. And then you have the fibula, which is the lateral or the smaller bone of the lower leg. Then once you get into the ankle connects the tibia and the fibula with the foot, and you'll find two distinct landmarks are the malleoli at each side of the ankle and the lateral at the lower end of the fibula, and then the medial malleosus, sorry, I can't even say that, at the lower end of the tibia. So these are the protrusions that you will see on the lateral and medial aspect of your ankle. And then that ankle consists of the bones, which are called the tarsals, and the foot bones are called the metatarsals. And then the bones in the heel are called the calcaneus, and then the toe bones are the phalanges. And you'll also notice that the phalanges are also on the upper extremities in the fingers. So the phalanges are also that. And again, in the foot, you have the metatarsals, the calcaneus, which is the heel, and the phalanges, which is the toe bones. All right, then we have the upper extremities. So each shoulder consists of several bones, the clavicle, the scapula, and the proximal humerus. The clavicle, or what we know as the collarbone, is located anteriorly. And then you have the scapula, or the shoulder blade, which is located posteriorly. And then you have the acromion process of the scapula, which is the highest portion of that shoulder. And it forms the acromioclavicular joint with the clavicle and is frequent area of shoulder injuries. Then you have the upper arm and forearm, which consists of three bones that are connected at the elbow. The bone between the shoulder and the elbow is the humerus. And then the radius and the ulna are two of the bones between the elbow and the hand. So the radius is on the lateral bone of the forearm, and it is always aligned with the thumb. So if you think of radius and thumb, that is where you're going to find it. That's also where you're going to find that radial pulse. And then the ulna is the medial forearm of that bone. Next, we'll talk about the wrist, which contains several bones called carpals. The bones of the hand are also called the metacarpals, and the finger bones, like the toe bones, are called the phalanges. By this point in the chapter, you're realizing that there's importance of anatomical terms such as superior, inferior, medial, lateral, anterior, and posterior. So these terms will be used throughout your text, and you will need to use them correctly to document and report your patient's injuries and complaints properly. But again, if you have plain English, that's okay too. Here is the skeleton of the body, and it will give you that diagram to show you what is all in there. All right, with joints, they are formed when bones connect to other bones. There are several types of joints, including the ball and socket joint and hinge joints. So the hip is an example of a ball and socket joint in which the ball of the femur rotates in a round socket within that pelvis. And then the elbow is an example of a hinge joint in which the angle between the humerus and the ulna, which are connected by ligaments, that bends and straightens, and as the name suggests, like a hinge. All right, so like the skeleton, the muscle protects the body, it gives it its shape, and allows for movement. There are also three other types of muscles: the voluntary, the involuntary, and the cardiac muscle. The voluntary muscle, or what they call the skeletal muscle, is under unconscious control of the brain via the nervous system. The involuntary muscle, or what they call the smooth muscle, is found in the gastrointestinal system, lungs, blood vessels, and urinary system, and it controls the flow of materials through these structures. Then you have the cardiac muscle, which is a specialized form of involuntary muscle, is found only in the heart, and it is extremely sensitive to decreased oxygen supply and can only tolerate an interruption of its blood supply for only a very short period. The heart muscle also has its own blood supply through the coronary artery system, and the heart also has a property called the automaticity. So this means that the heart has the ability to generate and conduct electrical impulses all on its own. So the heartbeat or the contraction is controlled by these electrical impulses. So here's a diagram of the three types of muscles: the skeletal muscle, the cardiac muscle, and the smooth muscle. So with the respiratory system, the purpose of the respiratory system is also known as the pulmonary system, are ventilations and oxygenation. So oxygen, which is the O2, is moved into the bloodstream through the inhalation, and carbon dioxide, which is the CO2, and then it is picked up by the blood and excreted from the body through exhalation. All right, so a number of structures make up the respiratory system. Air enters the body through the mouth and the nose, and it moves through the oropharynx and the nasopharynx. Then the pharynx is that area that includes both the oropharynx and the nasopharynx. So from the pharynx, air moves on a path toward the lungs, which is a leaf-shaped structure called the epiglottitis, which then closes over the glottis, which is that opening to the trachea to prevent food and foreign objects from entering the trachea during that swallowing. Then the larynx, or the voice box, contains the vocal cords, and then the cricoid cartilage is that ring-shaped or structure that forms the lower portion of the larynx. The larynx is again the voice box that contains the vocal cords, and the cricoid cartilage forms that lower portion. The trachea, or also known as the windpipe, is the tube that carries inhaled air from the larynx down toward the lungs. It is formed and protected by 16 C-shaped rings of the cartilage. At the level of the lungs, the trachea splits into two branches called the bronchi. One main stem, bronchus, goes to each lung. Inside each lung is the bronchi, which then continues to the branch and splits like a branch of a tree, called the bronchioles. And then that's where the air passages get smaller and smaller. Eventually, each end of the branch will end up a group of alveoli. The alveoli are the small sacs within the lungs where the gas exchanges and the exchange of oxygen and carbon dioxide take place within the bloodstream. The diaphragm is the structure that divides the chest cavity from the abdominal cavity. It is a large muscle that is primarily controlled by the phrenic nerve. And during a normal respiratory cycle, the diaphragm and other parts of the body work together to allow that body to inhale and exhale. And then the role of the diaphragm and other muscles in the respiratory cycle are described later here in the chapters. Here's the diagram of the respiratory system. So with inhalation, that is an active process. That is when the diaphragm and the intercostal muscles contract, the diaphragm moves downward, and the ribs move upward and outward. And it is negative pressure that pulls air into the lungs. Exhalation is known as the passive process, which that's where the diaphragm and intercostal muscles relax, and then the positive pressure pushes air out of the lungs. Ventilation is the movement of gases to and from the alveoli. Respiration is where the exchange of gases between cells and the bloodstream happen. Oxygenated blood is carried from the lungs to the heart and then is pumped out to the rest of the body. At the cellular level, oxygen is exchanged with the cells for waste of carbon dioxide. Deoxygenated blood then returns to the heart, then to the lungs to exchange the waste CO2 for O2. Here is the comparison of a child and adult respiratory anatomies. So they are a little bit different, so keep that in mind when you're doing your assessments. The cardiovascular system consists of the heart, the blood, and the blood vessels. It is also called the circulatory system. In the anatomy of the heart, you're going to see that you have 4 chambers. You have 2 atria, which is in the upper area, and 2 ventricles in the lower area. The pathway of blood through the heart is the right atrium, right ventricle, left atrium, and left ventricle. To know how this works is going to very much benefit you in your testing processes. Here's how the path of blood flow goes through the heart. Here's the cardiac conduction system, and this can be found in your book as well. Important arteries to know are going to be the coronary arteries. That is the one that branches off from the aorta and supplies the heart muscle with blood. The next one is the aorta, which is the largest artery in the body. Next is going to be the pulmonary artery, which begins at the right ventricle, and it carries oxygen-poor blood to the lungs. You may notice that this is an exception to the rule that arteries carry oxygen-rich blood and veins carry oxygen-poor blood. It does, however, follow the rule that the arteries carry blood away from the heart while veins carry blood to the heart. Next is the carotid arteries. They are the major arteries of the neck, and you will be familiar with these vessels from your CPR class that you should have already taken. So the carotid artery is that you can palpate during CPR. So that's where you're going to check that adult and child pulse is in the carotid artery. And next is your femoral artery, which is the major artery of the thigh. So again, when you talk about, or you can relate it to that name of the femoral, to the bone in the thigh, remember the femur is the femoral, and that is where you're going to find that artery is in the femoral area. It's not a very easy pulse to find, but you can find it if you have to, and we do typically look for this pulse during cardiac arrest if we have to. Next, you have the brachial artery, which is in the upper arm and is the pulse checked during that infant CPR. Then you have the radial artery, which is the artery that travels through and supplies the lower arm. And remember, the radial artery is the artery felt when taking a pulse at the thumb side of the wrist. Then you have your posterior tibial artery, which is the artery that is often used when determining the circulatory status of the lower extremities. And then your posterior tibial artery may also be palpated on the posterior aspect of the medial malleosus. Then you have the dorsal pedis artery, which lies on the top portion of the foot, lateral to the large tendon of the big toe. Here you're going to see the arteries, capillaries, and veins. Composition of blood. The blood is made up of several different components, including plasma, red and white blood cells, and platelets. So plasma is the watery, salty fluid that makes up more than half the volume of the blood. The red and white blood cells and platelets are then carried in the plasma, and that's where waste and carbon dioxide from the cells also dissolve in plasma to be transported back to the lungs. Next, we have the red blood cells, which are also called RBCs. Their primary function is to carry oxygen to the tissues. That's when the hemoglobin molecules on these cells can also provide the red color to the blood. Then you have white blood cells that are also called WBCs, and they are involved in destroying microorganisms and producing substances called antibodies, which help the body resist infections. And then last you have platelets, which are the membrane enclosed fragments of a specialized cell. So when these fragments are activated, they release chemicals, the clotting factors needed to form blood clots. So with pulses, you have a pressure wave of blood flowing down an artery when the left ventricle contracts, and it can be felt by compressing an artery over top of a bone. So the radial, brachial, posterior, tibial, and dorsal pedis are called peripheral pulses because they can be felt on the periphery or the outer reaches of the body. The carotid and the femoral pulses are also called the central pulses because they can actually be felt in the central part of the body. So because they are larger vessels closer to the heart, the carotid and the femoral pulses can be felt even when peripheral pulses are too weak. So you have pulses near the center of the body, and then your carotid and your femoral pulses can be felt even when the peripheral pulses are too weak to actually be felt. Next, we'll talk about blood pressure. So that is the force the blood exerts against the walls of the blood vessels, known as blood pressure. So usually the arterial blood pressure, or the pressure in the artery, is what's measured. So each time the ventricle of the heart contracts, it forces blood out and into circulation. So then the pressure created in the arteries by this blood is called that systolic blood pressure. So that's that top number on your blood pressure. So if it's like 120/80, the systolic portion is the 120. So when the left ventricle of the heart is relaxed and refilling, then the pressure remaining in the arteries is called the diastolic pressure. And the systolic pressure is reported first, and then the diastolic is second. So again, as 120/80, it is written as 120/80, and 80 would be the diastolic blood pressure. Next is perfusion. So perfusion is the movement of blood through the heart and the blood vessels, which is called circulation. In the healthy individual, circulation is adequate. That is, if there is enough blood within the system and there is a means to pump and deliver it to all parts of the body efficiently. So the adequate supply of oxygen and nutrients in the cells of the body with the removal of the waste products, that is what is called perfusion. Then they have hypoperfusion, which is also known as shock or inadequate perfusion. It is a very serious condition. So with hypoperfusion, there is an inadequate circulation of blood through one or more of the organ structure or the structures. So the blood is not reaching and filling all of the capillary networks of the body, which means that the oxygen will not then be delivered to and waste products will not be removed from all of the body's tissues. So hyperperfusion, like we said earlier, is serious and it can lead to death. So it is important to understand that hyperperfusion is how it occurs and how it is recognized. So this will be discussed more, throughout the chapters, especially when we get into more of the medical stuff and even into the trauma and bleeding and shock section as well. So let's think about it. How is the function of the respiratory system related to the function of the circulatory system? So the respiratory system moves oxygen into the bloodstream through inhalation, and the carbon dioxide is picked up by the blood and it excretes through the exhalation process. And then the circulatory system is the heart, the blood, and the blood vessels. So the respiratory system needs that circulatory system in order to bring in the oxygen and remove the carbon dioxide from the body. So the respiratory and the circulatory system together make up the cardiopulmonary system. So that interaction of the two systems is very essential to living. All right, so next is the life support chain. So the interaction of respiratory system and the cardiovascular system is the cardiopulmonary system. So with perfusion, that's where the cells are oxygenated and carbon dioxide is then removed. So next, the lymphatic system. So the lymphatic system is a collaboration of organs and tissues and thin walled vessels and the fluids that are found throughout the body. So one chief function of the lymphatic system is to capture the fluid, or otherwise called the lymph, that escapes from the cells and tissues and returns it to the bloodstream. In this way, the lymphatic system function is to maintain a balance of fluids within the body. So it's the associated lymphoid organs also has an immune function producing lymphocytes and other white blood cells that can fight infection. So in fact, the lymphatic system is a very critical part of that body's immune system. All right, the lymphoid organs, which include the adenoids, the tonsils, the spleen, and the thymus. So the lymphatic system also consists of lymph nodes that are normally soft and round or even irregular shaped. These nodes filter lymphatic fluid and removing the bacteria and foreign cells, as well as making the lymphocytes and other infection-fighting cells. So you might recall your physician feeling the lymph nodes in your neck when you go in for a clinic appointment. So what they're examining for is any enlargement or tenderness in those lymph nodes, which could be a sign of an infection. So women who happen to have breast removed or a total mastectomy because of breast cancer will often be instructed not to allow blood pressures being taken on the arm as the same side as the mastectomy was taken. This is because a mastectomy often includes removal of the lymphatic tissues from that armpit area. And the compression of the inflated blood pressure cuff on that upper arm can potentially damage the fragile remaining lymphatic tissue that is there. So as an EMT, you must avoid taking blood pressures on the side of a woman's body where a mastectomy has been performed. Once in a while, you may not know that she has had, but if she's conscious enough to let you know, she will tell you to not do a blood pressure on that arm. And that should be something that you're getting used to of asking is there an arm that you can't have a blood pressure on? Or is there an arm that you would prefer the blood pressure be on? Because sometimes in an emergency situation, they might not think about it until you actually ask that question. Here is a diagram of the nervous system. In the nervous system, you have what is called the central nervous system, which includes the brain and the spinal cord. So you got to think of your brain like the little computer that receives information from the body, and then in turn it sends those impulses to different areas of the body to respond to the internal and external changes. So the spinal cord rests within that spinal column and stretches from the brain down to the lumbar vertebrae. So the nerve branch from each part of the cord and reach throughout the body. So a key function of the central nervous system is consciousness. So the reticular activating system is a series of nerve pathways in the brain and is essentially responsible for keeping a person awake. Then you have the peripheral nervous system, which consists of two types of nerves, the sensory and the motor nerves. And the sensory nerves pick up the information from throughout the body and then transmit it to the spinal cord and then the brain. So if you touch something hot, your sensory nerves then transmit this to the spinal cord and the brain, and so immediate action may be taken. But the motor nerves then carry those messages from the brain back to the body. And then last, you have your autonomic nervous system, which is the division of the peripheral nervous system that controls the involuntary motor function and affects such things as digestion and your heart rate. And then within the autonomic nervous system, it can then be further broken down into the sympathetic and the parasympathetic nervous system and so on. So I highly recommend reading about this and understanding it and knowing what each one does. Onto the digestive system, which provides the mechanisms by which food travels through the body and is digested or broken down into absorbable forms. So the food enters the mouth and is broken down by saliva and by chewing. And then that's when the food passes from the mouth through the oral pharynx and into the esophagus, where it is then transported to the stomach. So except for the mouth and the esophagus, all other organs of digestion are contained in that abdominal cavity. So the stomach, for instance, the stomach is that hollow organ that expands as it fills up with food, and in the stomach that acid or acidic gastric juices then begin to break down that food into components that the body will then be able to convert into energy. Then the next one is the small intestine, which is divided into three parts: the duodenum, the jejunum, and the ileum. So this organ then receives the food from the stomach and it continues to break it down for absorption. That's when the nutrients are absorbed by the body through the wall of that small intestine. And then next is the large intestine, which is the colon. And the large intestine removes water from waste products as they move toward the elimination from the body. So anything not absorbed from this point is moved through the colon and exerted as feces or your bowel movements. Then you have what is considered your accessory organ. So the first one is the liver, which produces bile, which then is excreted into the small intestine to assist in the breakdown of the fats. And the liver has many additional functions, though, including detoxifying any harmful substances, storing any sugars, and then assisting in the production of blood products. The next one is your gallbladder. So that gallbladder serves as that storage system for the bile from the liver. And this is the one that can be taken out. A lot of people don't have their gallbladder anymore. It's just a little tiny flat green piece that's within your abdomen. Then you have the pancreas, perhaps known as the production for the hormone insulin, which then is involved in the regulation of the sugar in the bloodstream. So that also secretes the juices and assists in breaking down the proteins, carbohydrates, and fats. Next, you have the spleen, which is acting as the filtration system. So the spleen filters out all other blood cells. It has many blood vessels and at any given time can hold significant quantities of blood reserve from the body, and that can actually be used in cases of significant blood loss. So if you have a splenic rupture, you know you have a serious problem on your hands. And then last is the appendix, which is located near the junction of the small and large intestines, and it is made up of lymphatic tissue. So its exact function is not really well understood, but it is often considered to be part of the digestive system because it is an infected appendix, which causes what is called an appendicitis, is a very common cause of abdominal pain. So if you do have a patient with abdominal pain, remember going back to your 4 quadrants in the abdomen, if they have the pain in that area. The problem is that with the appendix, they can have what's called referred pain, and they can actually have pain in other areas, but it would still actually be your appendicitis or your appendix having issues. Okay, next we're going to move on to the integumentary system. So the integumentary system consists primarily of the skin. So the first one is protection. So the skin serves as that barrier to keep out microorganisms, debris, and any unwanted chemicals. So the underlying tissues and organs are protected from the environmental contact. So this helps preserve the chemical balance and body fluids and tissues. So the other side of it is if you have a motor vehicle crash that you're out to and they have an open wound, or no matter what it is, motor vehicle, it could be a burn, it could could be, a medical condition where they have their skin is broken for whatever reason. That is an open door to infection. So that's why it's really important that the skin stays intact, because it is that protection side of it. If you do go out to a call and there is broken skin, the first thing you want to do is make sure you rinse it and so forth, and then put a bandage over it to protect it from the outside environmental contacts. The next one is water balance. This is where the skin helps prevent water loss and stops the environmental water from actually entering the body. Then the next one is temperature regulation, which is where the blood vessels in the skin can dilate to carry more blood to the skin and allow the heat to radiate from the body. So when the body needs to conserve heat, these vessels constrict to prevent heat loss. But then the sweat glands found in the skin produce perspiration, which will then evaporate and help cool the body. And then that fat layer beneath the skin also serves as that thermal insulator. So again, the temperature regulator, when they stop sweating or when they stop shivering, you know that you're in a true emergency at that point, because shivering and sweating are actually part of that temperature regulation. The next one is excretion, which is the salts and excess water that can be released through the skin. And then shock absorption or impact is where the skin and its layers of fat help protect the underlying organs from any minor impacts and pressures. So just keep that in mind. All right, then we have the layers of the skin. So there's 3 layers: the epidermis, dermis, and subcutaneous. So the outer layer of skin is the epidermis. So that's composed of those 4 layers, except for when you're talking about the palms of the hands or the soles of the feet. Those will actually have 5 layers. Then you have the layer of skin below the epidermis, which is the dermis, which is rich with blood vessels, nerves, specialized structures such as your sweat glands and so forth, as well as the oil glands and the hair follicles. So the specialized nerve endings are also found in the dermis. So that's when they get involved with the sense of touch and reaction to cold and heat and pain. So once the dermis is actually open to the outside world, that's where contamination and infection become a major problem. And these wounds can be very serious, accompanied by profuse bleeding and very intense pain. And then you have all the lowers, or the layers below that. So the layers of fat and soft tissue are below the dermis, which then makes up that subcutaneous layers. And that's where shock absorption and insulation are major functions of this layer. So again, the tissue and bloodstream contamination, bleeding, and pain are problems when these layers are injured or exposed. Here's the layers of the skin. All right, next is the endocrine system, and the endocrine system produces chemicals called hormones that help to regulate many body activities and functions. Then you have the pancreas, which is a key organ of the endocrine system, and it secretes the hormone of insulin. So remember, insulin is very critical to the body's use of glucose, which is that sugar that fuels the body. And then you have the adrenal glands that are also an essential component of the endocrine system, and they secrete epinephrine, or also known as adrenaline. So when they talk about epinephrine, it's also adrenaline, and then that norepinephrine. So these chemicals serve as that neurotransmitter and engage the sympathetic nervous system through a series of chemical receptors located in specific organ systems. Here is the endocrine system. Then we have the renal system, which is also called the urinary system. It helps the body regulate fluid levels, filter chemicals, and adjust the body's pH. Then with the kidneys, that is your principal organs, and the bladder is that fluid reservoir for all of the urine. Here you will have the renal and urinary system. Your ureters transport the urine to the bladder from the kidneys, and the urethra excretes the urine from the bladder to the external environment. All right, so we are going to move on to the reproductive system, and we'll start out with the male portion of it. So there's the primary organs are going to be the testes and the penis. So the testes produce the sperm, which is the male component of the reproduction, and are housed outside the body in the scrotum. The testes are then connected to the penis through a small tube called the epididymitis. So then the penis is in the external reproductive organ of the male and is used for both sexual intercourse and urination. Here is a diagram of the male reproductive system. With the female reproductive system consists of the ovaries, the uterus, and the vagina. So the ovaries are located bilaterally in the lower quadrant of the female's abdomen to serve and to develop and release the ova or the eggs for reproduction. So the ovaries are connected to the uterus via the fallopian tubes, also called the oviducts. So the fallopian tubes are the site where the sperm fertilizes and descending the ovum. And then the uterus, which is the muscular organ located along the midline of the lower quadrants of the female's abdomen. The uterus is also designed to contain the developing fetus through the 40 weeks of pregnancy. Although it is a small organ, it has a huge potential to growth as the pregnancy develops. And it is also highly vascular at times of pregnancy and can be prone to serious bleeding. And then the uterus connects to the vagina, or what they call the birth canal, during pregnancy, and the vagina then serves not only as the exit route for the fetus, but also as the female reproductive organ and a site of, obviously, sexual intercourse. Here is a diagram of the female reproductive system. All right, here's the chapter review. As an EMT, your knowledge of anatomy or structure and the functions or physiology of the body will be important in allowing you to assess your patient and communicate with your findings accurately and efficiently to other EMS personnel and hospital staff. Major body system with which you should be familiar with is the musculoskeletal system, the respiratory system, the cardiovascular system, the nervous system, and the digestive system. Major body systems in which you should also be familiar with is the integumentary system, endocrine system, renal system, and reproductive system for both the male and the female. Remember that cellular metabolism requires a constant supply of oxygen and glucose. An absence of either component disrupts the normal metabolism. Cardiopulmonary system combines the functions of respiratory and cardiovascular systems to provide oxygen at a cellular level. Remember that shock occurs when the cardiopulmonary system fails and cells become hypoperfused. The body is comprised primarily of water, and this fluid is distributed throughout the body systems. Here's some questions to consider. When evaluating a patient with a cardiac problem, consider the impact on the respiratory system. When evaluating a patient with a respiratory problem, consider the impact on the cardiovascular system. What impacts do problems in these systems have on each other? Another question to consider is shock must be recognized immediately. What is the pathophysiology of shock? For critical thinking, you are treating a patient who has recently released from the intensive care unit with a massive infection, or also known as sepsis. This has impaired the patient's ability to regulate the size of the blood vessels. How might this affect the patient's ability to compensate for any additional illnesses? And what steps should you take to help this patient compensate?